Good afternoon. My name is Janet North and I reside in Baltimore, Maryland. I guess the best way to describe myself would be to say that I am a prodigal scientist. Growing up, I was always surrounded by doctors, nurses, nuclear scientists, and various types of researchers, and though my path began in the direction of science, I purposely detoured down an entirely different road, which was hospitality and finance. Somewhere along the line, smiling pretty and counting other people's money became unfulfilling. Approximately 15 years ago, I was lured back to the science world when offered an opportunity to learn post-mortem analysis, and I've been doing this work ever since, except now I just do it on an on-call basis only. My return to the sciences led me to Coppin State University, where I obtained a Bachelor's of Science degree majoring in biology and minoring in chemistry and theater. Now, I know that is a strange combination, but I am a strong believer that a multidisciplinary approach is key to solving many of our complex issues in society, and I seek to be prepared. While at Coppin State University, I was known by most as one of the water girls because during my time there, I researched social and environmental factors contributing to the degradation of Baltimore City water supply, its effects on aquatic ecosystems, and public health and possible solutions to the problem. Just recently, I've had the opportunity to work as a fellow on a pilot project that was launched just last year in 2016. The project is a collaboration between the Federal Communications Commission's Connect to Health Task Force and the continued water research at Coppin State University. First, I would like to tell you a little bit about the water research. Second, I'm going to talk to you about the C2H or Connect to Health portion of the research. Being the most abundant inorganic compound, we all know the importance of water. All living things need water to survive, and when pollution and toxins enter the waterways, it can have drastic effects on the ecosystem and devastating effects on public health. As we watched the Flint, Michigan water crisis unfold, we saw that even heavy metals in high quantities can also have severe effects on ecosystems. But before I go on, I want to share with you an extremely useful method that has and continues to play a significant role in this research, and that is the social and environmental synthesis approach, or as it is commonly known as the SES, which falls right in line with the Future of Public Health mission. SES is a research approach that accelerates the production of knowledge about complex interactions between human and natural systems. The approach involves integrating data, ideas, theories, or methods from natural and social sciences. This may result in new data products, particularly ones that address questions in new spatial and temporal contexts or scales. SES may also involve evaluating textual or oral arguments, interpreting evidence, developing new applications or models, or identifying novel areas of study. The method allows the researcher to look at an issue from various sides, socially and environmentally. Under the social umbrella, researchers have a chance to study a problem from the aspects of politics, policy, and social behavior. Through the environmental lens, researchers pay attention to the ecological and biophysical effects of the issue. The hope for end result of such a synthesis methodology of scientific research is to establish a focused attempt to address complex issues in our world. The initial implementation of the social environmental synthesis approach to our research determined that the research would be multi-layered in an attempt to answer the following four questions. Number one, is Baltimore City water quality as defined by EPA standard adversely affected by natural and man-made water filtration factors? Number two, do hormones, especially estrogen found in Liberty, Lock, Raven, and Pretty Boy watersheds have adverse effects on the health of aquatic ecosystems? Number three, are the existing legislations and enforcement of laws or lack thereof an accurate reflection in the quality of water in Baltimore, and what are the social implications? Number four, is the health of Baltimore City residents adversely affected by Baltimore City water quality and the aquatic ecosystems within its watersheds due to the impact of hormones, pharmaceuticals, and DPBs, or disinfectant byproducts? With this portion of the research, I strive to discover causes of deterioration, possible social and environmental solutions to restoring the water quality and preventing any further contamination. The second portion of the research deals with the challenge that was given by President Obama to create a means for Americans to access affordable quality health care and determine what are some of the connectivity obstacles preventing such access. That challenge was accepted by FCC Commissioner Clyburn, who spearheaded Connect to Health, a senior-level, multidisciplinary task force created to bridge the gap between broadband and rapidly advancing healthcare technologies. So the first thing that had to be done was to determine what were some of the barriers, and this was done by mapping broadband health in America. What this mapping revealed was that many Americans live in rural locations and the infrastructure for broadband is not in place, or the infrastructure is there, but the adoption is minimal. Americans feel the cost of broadband services outweigh the perceived necessity of the service, or Americans are unaware of connective health resources available, such as telemedicine, telehealth, and educational webinars. And finally, Americans lack the availability of healthcare providers. Also, from a provider standpoint, some of the obstacles are overwhelming caseloads in rural areas, lack of funding for newer technology, proper reimbursement for services provided, and the concern for out-of-pocket costs for their patients. The Connect to Health Task Force Mapping Broadband Health in America tool allows users to visualize, overlay, and analyze broadband and health data at a national, state, and county level. The maps are interactive experience showing various pictures of the intersection between connectivity and health for every county in the United States. The FCC is only one part of the broadband health ecosystem, and it takes input from patients, healthcare providers, broadband providers, community leaders, software developers, politicians, educators to help bridge any gaps revealed by the map. Some of the potential benefits and uses are that it's a valuable tool for highlighting areas that might require some special attention. They will also be helpful for stakeholders to identify the types of collaborations that may be needed to improve connectivity health. For the FCC and other agencies, the maps can be used to characterize regions, patterns, and gaps to inform policy, regulatory actions, or reforms. For private sector, the maps can identify areas where entrepreneurial opportunities for enabling consumer health through broadband exist now. And local communities, health departments, and researchers may find their maps helpful as they allocate resources and focus efforts on leveraging broadband connectivity for health. We absolutely need continued collaborative efforts across disciplines, the combined outcry of citizen voices, and the raised awareness and education of public at large to make pre-existing laws and agreements more effective and more protective of waterways, aquatic ecosystems, and most importantly, our public health. This collaborative research provides an opportunity for all of us who care about clean water, fishable waterways, and public health to closely monitor changes in our watersheds and through our broadband WIFs in an attempt to implement restoration and prevention. We look forward to the day when our rivers, streams, and residents' homes are no longer diagnosed with raw sewage with a prescription of pharmaceutical waste. And dream of a day when broadband enables all Americans to reach out and connect to healthcare resources, because so much is riding on the health of each and every one of us. So with that being said, I end this introduction and wish you all well as you move forward towards your careers in public health. Thank you very much.